Hurricane Melissa has picked up speed as it moves towards Bermuda after causing destruction across much of the northern Caribbean. Local authorities have reported nearly 30 deaths, but say that number is likely to rise. Haiti has the highest number of victims. Martin Dickler is the country's director for the International Aid Group. He says the country is in urgent need of safe drinking water and food.
We're having our teams gathering information on the extent of the damage across the country. CARE has teams in 7 of the 10 departments, which are the states in Australia, the departments here in Haiti. We've received already many disturbing reports. One town, Petit Guave, is practically underwater. That's where 28 deaths so far have been reported. And we are expecting that there will be more deaths before we can have all the information coming in. This process will probably take a couple of days.
What was the biggest factor? Was it the wind, the rain?
The biggest factor was the rain, and that's caused a lot of flooding. It's destroyed crops. And this is in a country that was already very vulnerable, which was already experiencing an acute hunger crisis even before Hurricane Melissa. So the impact on Haiti, because of its vulnerability, has been much greater than in neighboring countries in the region, even though the hurricane struck the country with less force than our neighboring islands.
Where are people being accommodated? Are there emergency shelters being used?
Yes, there are some shelters, but unfortunately, that's one of the problems that, we've been undergoing a crisis of political instability, gang violence, and so that has really affected the capacity of the country to respond to these kind of emergencies. CARE is working closely with local authorities. As I mentioned before, we have projects all over the country where we provide support to face the food insecurity crisis. We support small farmers who will be very hurt and affected negatively by having many of their crops have been literally destroyed by the heavy rains. We also work closely with local partners, many of them who are women-led organizations, and this helps us to gain access to communities because there's a factor of trust. In any crisis, and this one is no exception, women and girls are always disproportionately affected.
Martin, is power an issue? How much of Haiti has power?
Well, it's hard to say because power has always been an issue. Even before Hurricane Melissa, much of the country did not have electricity. And if it had it, it was only for a few hours. So, of course, in the communities that have been affected, they even have less power now. And that, of course, is making it more difficult to communicate with people. Telephones are not able to be charged. And that is why we have asked our teams to go out to the communities between today and tomorrow to really evaluate what the effects of the hurricane have been.
There have been calls for wealthy countries to help with aid, with getting people on the ground. Have you seen evidence of that?
Yes, we are starting to see evidence of funds coming up. CARE, as such, has appealed for funds to meet the crisis. We already have ongoing projects in many of the areas that were affected by Hurricane Melissa. And of course, we will need additional resources to be able to meet these needs that have been created by the negative effects and the impact of the hurricane.
What specifically are those needs?
Well, I would say, first of all, clean drinking water is very important. We've had a resurgence of cholera over the past couple of years in Haiti after it having been absent for about 10 years. And this is only going to be worsened by contaminated water, which is one of the impacts that we're having from the hurricane, from the heavy rains and flooding. A lot of the towns are underwater already. And infectious diseases like cholera, typhoid, and others I fear that they will become more rampant. So that is an urgent need. Another urgent need, of course, is food in a population where, in a country where half of the population, over half of the population, goes hungry and is facing acute food insecurity.
Well, we wish you all the best. Martin Dickler from the aid group CARE, thank you for talking to us.
Thank you very much for having me.